like to thank you for joining us today. Our topic this month in October is breast cancer awareness, and if you could introduce yourself and tell us what you do.
So my name is Dr. Robin Kindred. I'm an OBGYN here at the Methodist Mansfield Hospital. My group name is Women's Health Specialists of North Texas.
Okay. And if you could just kind of talk to us a little bit about breast cancer. First of all, when should someone first start getting the screenings?
So that's a complicated question, or a complicated answer rather.
Okay.
So you should start your clinical breast cancer screenings at 25 when you get your clinical breast exam during your annuals.
Mm-hmm.
And then you should start your mammograms at age 40. Okay. Now there is a little bit of lack of consensus as far as how often you need to screen between the ages of 40 and 50, but most governing bodies agree that you should start mammograms at age 40.
Okay.
Okay.
And then how long do you do that?
So you should continue to get your mammograms at least until age 75.
Okay.
And as long as you're in good health, you should continue them throughout your life.
Okay. Are there any myths or preconceived ideas that people have about mammograms?
So sometimes people worry about the radiation associated with mammograms, and they feel that maybe mammograms cause you to get breast cancer, and they seem reluctant to get them. And to that I would say the amount of radiation that you get through a mammogram is very low. It's just like a simple x-ray. And it is hands down our best imaging modality to detect and screen for breast cancer.
Okay. Are there people that are more predisposed to breast cancer, or, I mean, how prevalent is it? Kind of give me some info.
So breast cancer is the most common cancer diagnosed in women. 1 in 8 women in this country will get breast cancer at some point in their life.
Wow.
So that is quite a bit. So everyone should be vigilant. Risk factors for breast cancer, of course, being a woman.
Mm-hmm.
Family history of breast cancer can also increase your risk of 1.5 to 2 times the average. If you have a breast cancer gene, then of course you have a 70% chance of getting breast cancer.
Is that the BRCA?
The BRCA gene, exactly.
Okay.
So the BRCA gene is not very common, but when you do have it, it can confer serious risk of breast cancers, ovarian cancers, and other cancers.
Okay.
Usually when people are diagnosed with breast cancers at a young age, or if they have multiple first-degree relatives with breast cancer, then we recommend preferably the person with breast cancer to be tested for the BRCA gene.
Mm-hmm.
But if that person is unavailable, let's say that you know your mother passed when she was 30 from breast cancer, then you yourself should be tested for the BRCA gene.
And so if you take this test and you have that gene, what does that mean?
So that means, of course, you have an increased lifetime risk of getting breast cancer.
Uh-huh.
And so we recommend increased screening. So for those persons with the BRCA gene, they should start their screening at age 25 with annual mammograms and annual breast MRIs.
Mm-hmm.
You'll also be very diligent in doing your breast exams. And then after you complete your childbearing, we can talk about risk-reducing strategies to reduce your risk of breast cancer, like a mastectomy,
Mm-hmm.
or removal of the ovaries, a oophorectomy.
Oh, okay.
Yes. So the most famous person that had the BRCA gene, of course, is Angelina Jolie.
Yeah.
So her mother had BRCA1, mother died of ovarian cancer, and so she had her mastectomy and then later had her oophorectomy, which is the removal of the ovaries.
Okay. And so, and that pretty much then,
That reduces her risk significantly, so
Okay.
less than 5% chance of getting those cancers.
okay. Are they associated with any other kind of cancers? You said ovarian cancer.
Mm-hmm.
Is there any other?
So BRCA is usually associated with breast, ovarian, peritoneal cancers. Sometimes also in men who have the BRCA gene, prostate cancers, endometrial cancers for some women, things like
Okay.
that.
Okay. Anything else that the community at large needs to know about as far as breast cancer and what they can do or what they should do?
So the other things you need to know are there are some modifiable risk factors for breast cancer.
Mm-hmm.
So maintaining a normal weight throughout your life will help to prevent breast cancer.
Oh, I didn't know that. Okay.
So weight gain, especially weight gain after menopause, increases your chances of getting breast cancer.
Wow, and you're almost going to gain weight after menopause, so that's difficult. Okay.
Exactly. So
Okay.
as much as you can, staying active is also protective against breast cancer.
Mm-hmm.
So people that adhere to the at least 150 minutes of activity throughout the week have a lower incidence of breast cancer. Drinking alcohol increases your risk of breast cancer. Even as little as 1 drink per day can increase your risk. So we recommend, especially for women, that you don't drink very often, maybe 2 or 3 a week, as opposed to 1 a day.
Okay.
Okay. Some things that are sort of out of your control, if you started your periods early, if you went through menopause late, if you were older when you had your first child, or if you did not breastfeed, those things also increase your risk of breast cancer.
Okay.
Okay. So I think the important thing is to be aware of your risks and know if you are at increased risk to be diligent about your screening.
Okay. That's the number one thing.
Yes. Know your
The
risks
screenings.
and adhere to your
Yeah.
screening.
Okay.
Mhm.
Thank you so much for taking your time to visit with us. If someone wanted to set an appointment with you, how would they go about doing that?
Well, you can always go to the website
Okay.
at whsnt.com,
Okay.
or you could always give a phone call to the office,
Okay.
972-938-3493.
Okay. Excellent. Thank you so much.
Thank you.